Okay, hey everyone, happy Halloween. And let's just skip to the good part. The chemo worked, the cancer is suppressed, I'm in no pain, and I think I'm going to need to renew my library card. I had an appointment with my oncologist this week to go over my latest scan results and blood work, and I wanted to give you an update on where things stand. Here's a pro tip. When your cancer doctor is smiling and laughing, you can begin to breathe a little easier. My PSA, which is that leading cancer marker for what I have, now registers at 0.76. If you remember, it was over 3,000 back in February. So that's a 99.97 drop. Dr. Rathkoff wants to see if he can get all the way down to undetectable. And it's still heading in that direction. It continues to come down with each of my tests. So my PET scan looked great too. She said that almost everywhere the uptake, that's how they measure how active the cancer is, got significantly less. Most areas went from levels that were above 50, and they're now down below 10. She kept saying she was really, really pleased and that the results were even better than she had hoped. I know the imaging, I wish I had it to show you, but lit up like a Christmas tree in February, and now I'm kind of like a dull ember in just a couple spots. My CT scan also looked good. She said if there were any other type of cancer, well, we'd just be high-fiving based on that imaging alone. It's just that prostate cancer has all these extra markers and shades of gray that have to be interpreted as some other kind of complications with it. And here's probably the most remarkable part. The left rib tumor, that was one that they biopsied back in March that showed that aggressive small cell neuroendocrine feature, which we're all worried about. It's completely resolved. That's what the report said. You use resolved, it means it's gone. It's not there anymore. And Dr. Rathkoff said that, you'd love to see resolved. So this is particularly significant because those cancers don't usually respond to hormones or that type of the type of chemotherapy, the docetaxel that I had. The fact that this area responded the best is really good about the nature of my cancer. It confirms that neuroendocrine component isn't really driving the aggressive disease the way we would worry that it may be otherwise. So now the reality is I still have cancer, right? And the other thing is that the CT showed that the cancer did a pretty good job on my spine back with the original sickness. Some compression fractures in my T9, 10, and 11. These got a bit worse since the last scan. They likely happened when the metastasis was most active. The good news is I don't have any significant pain from them. I have some general aches and pains, but that can be just from being an old fat guy too. So, and as I said, the other reality is I still have cancer. There are two spots that still show some residual activity on my hip and then in my spine. But again, both of those have gone down from stupidly significant highs back in February to now it's almost like where I just kind of like have normal cancer. So she said if the PSA is, eventually plateaus, we probably would do another PET scan and maybe do some radiation to those areas. Some of my buddies in my online support group call that whack-a-mole treatment. But right now, with everything still improving, there's no real reason to do that. We just need to have some patience while things continue on this positive trajectory downward. So, yeah. Again, the doctor emphasized the fact that because on cancer has responded so dramatically that even though, it looks and sounds like a neuroendocrine duct, it isn't. It's responding like what they call hormone sensitive prostate cancer, which has so many better treatment options and outcomes. It was really the amount of science that is going on right now really is incredible, between the immunotherapy therapies that are coming out. You look at some of the COVID vaccines they're now saying could have some effects on cancer. So there's so much activity going on. The idea is to kind of keep the cancer arrested, keep it asleep for as long as these other therapies can come around, because the therapies I'm doing right now weren't around 5 years ago. So like if you can get to that 5 years, then you're looking pretty good. I could go back and I could do the dose of Taxol again because it was effective, although I would never ever want to do that again. I would do it again. There's other therapies like Pluvicto. You've probably seen that between the third and fourth inning of the World Series. That's a PSMA targeted radiation therapy that you pop in your mouth. Side effects on those are less dramatic as the ones that I just kind of went through. And there are other things. So looking ahead, there is a treatment path. Another reality here is that the current treatments I take suck. They cause me to have spells of fatigue and brain fog. I've been knocked down a couple pegs here, which is quite frustrating. But then I think of the alternative, but I'll take it. The past 9 months have been really tough, to say the least, on me, on B, on the kids, on my parents, my family, and all of you who have been following along and supporting us. The fear and the uncertainty when I was first diagnosed, the hospitalization, starting treatments, there's shitty chemo. It's been tough. But sitting in that appointment, hearing Dr. Rathkopf say over and over how pleased she was, how great everything looks, and that we should celebrate was really meaningful. And this isn't just wishful thinking or trying to stay positive. This is actual medical evidence that the treatment worked, that the cancer is responding by becoming suppressed, and that I've got some time here. How much time, nobody knows. But right now, the trajectory is in the right direction, and that's what we're holding on to. The can has been officially kicked down the road. I can't thank all of you enough for everything, the messages, the calls, the visits, the meals, the prayers, the support. Knowing you're all out there pulling for us has made a huge difference. Bee's been absolutely incredible through all this. I couldn't have done it without her. And that's where we are. The scans look good. The PSA is still dropping. The big scary tumor is gone. The neuroendocrine features were the ones that actually responded the best. Obviously, we have a few things to work on, which is continue to keep the cancer suppressed, and I'm going to have to deal with my back. But overall, it's genuinely really, really good news. Oscar Wilde wrote that life is far too important a thing to ever talk seriously about. Well, I certainly screwed that piece of advice up. But in his spirit, I don't plan to spam you with any further updates for now. Let's just file my situation under no news is good news going forward. Of course, if you want to reach out, please do, especially if you or someone you know finds himself in a similar spot, I know that really helped for me. I immediately got messages from friends who are cancer survivors, who were cancer survivors, and as well as friends and family. The networks are out there that are incredible, and the advice that they gave me was really helpful. So please remember that if you hear of someone else who might need some words of enthusiasm or advice. So once again, thanks for being on this journey with us. And the next time we see each other, let's talk about the weather. Okay. See ya.